So good day everyone. I am Camille Dumpa from BSN 1A. Today I will be conducting a specimen collection. So a specimen is example of material taken from the patient's body to use in diagnostic and laboratory examination. Specimen collection means collecting a specimen. So here's the types of specimen collection. First is clean catch, midstream urine collection, 24 hours urine specimen collection, urine specimen collection from an infant, catheterized urine specimen collection, stool specimen collection, sputum specimen collection, and lastly is throat swab culture. Then, special considerations. So, the procedure of specimen collection may vary depending on the type of examination. An appropriate container must be clearly labeled, tightly sealed, and sent promptly to the laboratory. Proper precaution must be taken to prevent loss, spillage, and contamination of the collected specimen. Instruction to the patient must be clear to ensure properly collection of specimen and to help allay anxiety. And lastly is laboratory request must be completely and accurately filled out. So here's the nurse rules in specimen collection. First is patient interaction, suitable election of supplies, appropriate and proper collection, precise sample of identification, and lastly is up-to-date transfer to the lab. Clean catch urine collection. Midstream clean catch urine collection is the most common method of obtaining urine specimens from adults, particularly men. This method allows a specimen, which is not contaminated from external sources, to be obtained without catheterization. It is important to follow the clean catch protocol in order to have accurate results from an uncontaminated sample. So the purpose is the clean catch urine method is used to prevent germs from the penis or vagina from getting into a urine sample. It is a method of collecting a urine sample for various tests, including urinalysis, cytology, and urine culture. This is valuable for confirming alterations in metabolisms, infections, and fluid volume problems. And lastly is to determine appropriate antibiotic to administer to a specific patient. So here's the equipment or materials that we are going to use. First is container with warm water, soap, washcloth, antiseptic swab or cotton balls, sterile specimen container, label for the container, bedpan, and lastly is non-sterile gloves. Sputum is a dead cloth flame collected for laboratory analysis. A sputum specimen is a sample of material expelled from the respiratory passages taken for laboratory analysis to determine the presence of pathogens. Specimens are often taken for 3 consecutive days because it is difficult for the patient to cough up enough sputum at one time, and an organism may be missed if only one culture is done. So the purpose, a sputum specimen is obtained for culture 2. The first one is identify the microorganism responsible for lung infections. The second one is identify cancer cells shed by lung tumors. The third one is aid in the diagnosis and management of occupational lung disease. So here's the types of sputum examination. The first one is sputum culture sensitivity test. A sputum examination assesses the specific etiologic agent of respiratory tract infection and bacterial sensitivity to various antibiotics. The second one is acid fast bacilli staining, or EFB. Collection of sputum specimen for 3 consecutive mornings to assess presence of active pulmonary tuberculosis. The third one is cytologic or Papa-Nicoli sputum examination. Assess for presence of abnormal cancer cells. So here's the special considerations. Early morning sputum specimen must be collected. Collect sputum specimen of C and S before the first dose of antimicrobials is given to client. Use face mask to protective device if client is suspected PTB case. And lastly is note client's tolerance to procedure. So, here's the materials, equipments that we are going to use. The first one is sterile sputum specimen container with cover. Then, label for specimen, emesis basin, tissue paper, small plastic bag for delivery of specimen to laboratory, glass of water, and lastly is face mask. Throat swab culture. A throat swab culture is a laboratory test that is done to identify germs that may cause infection in the throat. It is most often used to diagnose strep throat. So, the purpose, this test is done when a throat infection is suspected, particularly strep throat. A throat culture can also help health provider determine which antibiotic will work best for the patient. So, here's the special considerations. Collect sputum specimen of C and S before the first dose of antimicrobials is given to client. Then, use face mask as protective device if client is suspected PTB case. And lastly is note client's tolerance to procedure. So, here's the materials or equipment that we are going to use. For the bacteria, culture swab or equivalent collection system. All others, virus, chlamydia, mycoplasma, collection pack. Then, label for specimen, emesis basin, tissue paper, small plastic bag for delivery of specimen to laboratory, glass of water, and then lastly is face mask. Good day, ma'am. I am Camille Dungpa, your student nurse for today.
Good day.
Okay, ma'am. Today, I'm going to conduct the specimen collection. Is that okay with you, ma'am?
Yes.
Okay, ma'am. So, I have a few questions. Is that okay with you, ma'am? Okay, ma'am. May I ask your full name?
I'm Princess May Magelo,
Okay. So, how old are you, ma'am?
19.
So, do you have any occupation, ma'am?
As of the moment, no, none.
Okay. So, have you been hospitalized before, ma'am?
No.
Good day, ma'am. I am Camille Dungpa, your student nurse for today.
Good day.
Okay, today, ma'am, I will be conducting a sputum specimen collection. Is that okay with you, ma'am?
Yes.
Okay, so I have a few questions, ma'am. Is that okay with you? So, May I ask your full name, ma'am?
Princess May Magelo.
How old are you?
19.
Do you have any occupation, ma'am?
None.
So, have you been hospitalized before? Good day, ma'am. I am Camille Dumpa, your student nurse for today.
Good day.
Today, ma'am, I will be conducting a truth swab culture. Is that okay with you, ma'am?
Yes.
Okay. I have a few questions, ma'am. Is that okay with you? May I ask your full name, ma'am?
I'm Princess May Magelo.
Okay. So, how old are you, ma'am?
19.
Do you have any occupation?
None.
Okay. So, have you been hospitalized before, ma'am?
None. None.